We are back here at Atlantic Health Systems, home of Atlantic Sports Health, with Dr. Christopher Hubbard, talking about foot and ankle injuries. We're going to talk a little bit about now turf toe and the Jones fracture.
Sure. So the turf toe is really an injury to the great toe, first toe joint. The term really started, I think, in the 1970s with the advent of artificial turf and the more flexible shoes, and this increase in this injury where the toe gets bent up. So that can be similar. A football player gets tackled from behind and the toe gets forced up. But typically can injure what's called the plantar plate. That's the ligament underneath the big toe joint. The two ligaments on the side, those are the collateral ligaments. So there can be a spectrum of injury to that. Typically that's treated in some form of immobilization, maybe a walking boot, some physical therapy, taping, but can be a significant injury or a lingering injury that can affect in terms of push off and strength and can affect the athlete.
Yeah, and what's interesting about that is the amount of force that gets transferred through that big toe.
Sure.
I mean, if you try to sprint or jump without your big toe, you can't come close to your maximal force production. Could someone have a minor turf toe sprain? Could it where it's just kind of something that you don't even know it's there, but it's not, the pain isn't bad enough to go see a doctor?
Yeah, sure. I mean, you can have a spectrum in terms of the type of injury, and some are certainly more severe than others, but yes, they can be less severe, but and you can see that sometimes that it's just a little sore or such, and just maybe a little weaker in terms of the strength and running and jumping and such.
And what's interesting, we talked about this before off camera, was that when you have a little minor tweak at the ankle, foot, toe, what have you, that's causing competencies in certain areas, which now lead to potential other issues. Can you talk a little bit about those types of issues that arise from?
Sure. I mean, I think certainly anytime you have an injury, whether you realize it consciously or not, you can compensate. And you walk differently, you put weight through the foot differently, and that can affect the local level in the foot or the ankle, but also affects in terms of the knee, the hip, or the knee, or the spine rather. And certainly that all is a chain reaction. It can interact with each other.
Yeah, I've seen so many athletes over the years, just might have a tweak in the foot and ankle, and right away I say, hey, we got to get this checked out, and we got to get this fixed, and we've got to rehab this correctly, because if you just kind of forget about it or you do something to compensate, it goes up the chain. Now all of a sudden you got hip issues, you got back issues, and people don't remember, well, it started at the foot, and then if you don't have the right therapist or doctor, you're treating the hip and back, but the cause was the foot and ankle.
Absolutely. So, I mean, I think the key point, if something's hurt or something is problematic, get that checked out early and at least know what the problem is, get a diagnosis, and at least an early treatment plan in terms of trying to not affect other areas and other joints. And that can be as simple as some physical therapy, an arch support, some insert in terms of the shoe. So sometimes there's simple solutions that help prevent other bigger problems from occurring.
So important. If you don't have your foot and ankle, if that's not set and healthy and secure, there's just future problems that are going to arise, which are very dangerous. Kind of having your wheels aren't aligned in your car.
Sure.
Your tires are going to get worn out, and all of a sudden you got issues, and you just wear out a lot faster.
Absolutely.
We do have a lifespan. Athletes do have a lifespan.
Sure.
I mean, athletes eventually, they wear out. I mean, right? We retire.
Absolutely.
And as a young athlete, you want to do everything you can to preserve. And the best ability is availability, right? I mean, when you really think about a performance of an athlete, you got to be available. And if you're injured or you have a tweak that leads to other things, it could be challenging.
Yeah, absolutely.
Yeah. Well, thank you so much. I really, am intrigued with the foot and ankle, and I know we're gonna come back on and do some more, dialogue about education or how we can help people understand this. But this is really great information that I think is missing, out there in the public in terms of the foot and ankle. People just think, it's not. They don't see a lot of muscle around the foot and ankle. They don't really think. People don't think about training the foot and ankle. We're going to come back. We're going to talk more about how do we prevent foot and ankle injuries.
Great.